This is your mother, maybe now, maybe 20 years from now. She was admitted into a long-term care facility last year after having difficulty getting around her house and with her memory. She walks with a walker, but she often forgets to use it. In fact, she fell last week because she was walking without it. Since then, she's been having difficulty getting around and has been placed in this wheelchair. The wheelchair is not fit for her, it's too high off the ground, and she doesn't know how to use the brakes. She actually fell again last night trying to get out of the same chair because she stood up without putting on the brakes. Because of recent funding cuts, she's on the waiting list to receive occupational and physical therapy, and in the meantime has been invited to a group exercise program in the lobby, but she doesn't want to go. She's worried that because of her memory issues, she'll be placed with a group of people who can't follow directions. There have been significant changes to how rehab is funded in long-term care in Ontario, and leadership is required to develop a cost-effective, meaningful program of rehab that can help people, like your mother, remain as active as possible, as safely as possible, for as long as possible. My research aims to address three main questions regarding rehab in long-term care: the who, the when, and the what. First, the who. Who should be receiving rehab in long-term care? Should your mother be receiving these services? She has memory issues and might not remember the safety techniques and the exercises that we teach her. Would she still benefit from these services? Next, the when. At what point during your mother's journey should we be providing her with rehab services? When she was first admitted into the home and had been having difficulty getting around her house? When she fell last week? Or do we wait until she falls and breaks her hip to provide her with rehab services? Lastly, the what. What is the best way to keep your mother active yet safe? Is group exercise right for her? Would having a physiotherapist come in daily be better? Is there a way we can get the nurses to keep her active? Or maybe there's simple techniques we could teach you, the family, to do with her when you come to visit. Imagine an alternate scenario where we have met your mother's rehab needs. Maybe the chair fits her, she is able to attend a group exercise program designed specifically for people with memory issues. Or a physiotherapist is able to come in daily to do balance and strengthening exercises to prevent the next fall. I will develop and test a model of rehab service delivery that will help achieve this alternate scenario. Doesn't your mother deserve the best rehab services?